Joining us this morning is Angela Morton from Recovery is Community Northwest PA Consortium Director. Hi, Angela. How are you?
Good morning, Luke. Good. How are you doing?
I'm great. Welcome to a brand new year.
Yes. Happy New Year.
Do you get excited about that, or is it just another page turned on the calendar?
Well, a little of both.
Okay.
Like you wake up the next day and everything's the same, but then you think 2023, how did we make it to here? How did we get here?
Well, and not to get too morbid, I guess, but I would imagine there are people that wake up every day and think that how did I make it here, with maybe some things that they're battling.
Well, we can look at that two ways. In ways that people are battling, maybe they've struggled with something and didn't believe that they would see the new year, didn't make it there, whether mental health or health concerns or substance use issues. That is part of the work that I do. And there are also people who found recovery or are working on their recovery or finding ways to reduce harm that wake up and realize this new day is a new beginning. So I think it's hopeful.
How important is it for those to hear those stories, those ones who do say, hey, I'm here another day and I appreciate this and I can help, maybe I can help others by sharing my story?
I think it's probably one of the most, if not the most important pieces of the work we do in addressing substance use. So you had mentioned the grant consortium. So we have federal grants in Crawford, Venango, and rural Erie County to address substance use in our rural area. And we aim to reduce stigma and to promote awareness and an understanding of the disease of addiction and how to find resources and find recovery. And really, we can talk a lot about that. Professionals, addiction medicine specialists, we can talk about that, but the people who can speak best to that are people with lived experience. So hearing that there are millions of people all over the nation, right here in our neighborhoods, that are working on their own recovery, and that could be one day of sobriety and reducing harm, or it could be years and years of complete abstinence or reduced use. So there's a variety of ways that looks. Recovery looks different for everyone, but listening to stories of people who are in recovery or seeking recovery and hearing what that has been like for them. There are people that would say, I made it through it alone. Somehow I did it alone. Other people would say, never try to do it alone. It's always best when you have support. I mean, the outcomes are better when you have support, but everybody's story is going to be a little different. And we want people to tell those stories so other people might be inspired to understand that they can find recovery too.
Talk about the folks who are working to support those in need and struggling. I would imagine people can get pretty emotionally involved in trying to help somebody, and that can lead to a number of things. Let's kind of talk a little bit about that.
Yes, so I had mentioned to you that some of the training that we're doing with the new grant that has been awarded to Crawford, Venango, and rural Erie County, that we're going to be doing some training for professionals on the front lines to learn new skills and therapeutic techniques to address substance use, while also trying to get training out there around compassion fatigue, that they called the cost of caring, like how it impacts us. So really anyone can become fatigued or get compassion fatigue, but people who are working on the front lines in caring professions, first responders who are caring for people every day, day and night, police officers, EMS, paramedics, nurses, doctors, counselors, caseworkers and case managers, anybody who's in a caring profession or in a caring role even just individually at home caring for someone. When you put your heart into that work or into taking care of somebody or helping someone and you believe you can help, you come into maybe a helping profession thinking, I'm going to have an impact. I have hope that I can change the world or fix the world or help people, and that's my desire. That at some point when you realize you're helping, but you can't necessarily succeed in helping every single person you meet, the frustration and the pain that can build becomes what we call compassion fatigue. And if people don't address that and realize, like, I'm doing too much, I'm answering phones at midnight when it's not really in my role to do, or I never say no to anything and I'm always trying to be there for everybody while forgetting that you need to eat and you need to sleep and you're allowed to say, I really need an hour to myself. Nobody knock on this door while I have my bath, or I'm going out for a walk in the woods and I'm not taking my phone with me because I just need some time to decompress. So it's really important, especially working in the fields like substance use and mental health, where you're wanting to help people who maybe have had long time struggles. It's not an overnight fix. So you need to be realistic in your expectations of, I can have an impact, I have hope that I can help, but I need to take care of myself in order to do that and do it well.
How much of that is projecting onto those people? Your thoughts, like you should just be like. It's a new day. There's a lot of things out there that you can take on. The world is yours. I don't understand why you're going through this.
So it's like saying to someone who has a clinical diagnosis of depression, and your serotonin and all of your neurotransmitters are different. So you have a legitimate reason that you can't get motivated, or that you can't get out of bed, or that you can't laugh when everybody else is laughing. There's a legitimate reason for that. It's like saying to someone...
I'm told because I'm not funny. That's why.
Well, it could sometimes be because you're not funny.
Yeah.
But really, when someone's struggling and we're not experiencing, we can have some sympathy and empathy for what they're going through. But saying to someone, oh, just put your shoes on and take a walk, when they have a clinical diagnosis that's impacting their ability to take a walk, or saying to someone, can you just quit using drugs? Like, go take care of your kids, or go back to your husband or your wife or your job. Can you stop drinking? Could you just stop using drugs? When your brain has changed so much that you believe you need that substance or that activity in order to survive. So your brain changes to the point where you're sort of tricked into not really being your most rational and healthy self, because it's harder to make that choice to say, yeah, I'm just not going to use today, because there's a physical reason you need to use when you're craving or going through a physical withdrawal. So it's not just we try to promote that addiction isn't a moral failing or a character flaw. It's a diagnosis. It's a medical condition that changes your brain and your body, and therefore requires attention. It requires professional medical therapy, counseling, or medication.
So for those trying to help, though, and they're projecting like that, I would imagine then it'd probably be easy for them to get frustrated over that. And that could lead to, again, is that part of that compassion fatigue you're talking about, where you're kind of you're pouring yourself into the situation and maybe not giving yourself an opportunity to just step away and look at how it's affecting you.
I think there are two pieces to that. Like, I think that, yes, if you invest more than another person is investing in their own self, it will be frustrating. If you want somebody else to eat healthier, to exercise, to stop doing an addictive behavior or using a substance, or if you are more invested in that person and their behaviors than they are, then yes, you're working really hard on something that you're pushing on someone and they may not even want. So yes, that can be frustrating, of course. But there's also this whole other thing we could talk about transference. And a transference is, as you said, like when you're transferring something that you feel or you need on that person. So a lot of us enter helping professions because we maybe have some of our own story, whether it's a family history of mental health or substance use or trauma. We enter caring professions because we are trying to fix some of our own pain and fix the world. So you hear in media or you hear people tell stories about how I lost somebody when I was young, so I became a doctor or a nurse, or I really struggled as a child with anxiety, so I became a counselor so I could help other children with anxiety. I became a police officer because of a crime that my family saw or somebody that was hurt. Or so we put our hearts in that work and we have these reasons, and sometimes that reason, it's okay for people to go, hey, back up a second. Is this still about me? I mean, are you still talking to me, or is this some of your own stuff? But we have to attend to that as professionals if we really want to be therapeutic and ethical and effective.
So does that get discussed during training sessions, or not really, or depending on?
You mean like when we get an education or a background in policing or psychology or counseling or medical school? I can't speak. I've been out of school for a while, so I can't speak to what's happening in clinical programs or like first responder programs now, but there's a lot more attention on being trauma-informed and understanding self-care. So we do training with the state police, the municipal state police in Erie County, and we do training on vicarious trauma, understanding what that can do to you when you're witnessing trauma every day for years and years, compassion fatigue, the risk of mental health and substance use and suicide when you're working on the front lines in those kind of spaces. So yes, the training is needed, and it is often offered as like continuing education, but we need to weave more and more of it into the foundation of the training that we get, for sure.
You're watching the Morning Drill on Stream Television and on Armstrong's Neighborhood Channel, and listening to it on the Allegheny News Talk Sports Network. Angela Morton with us here this morning. And we can continue to talk about compassion fatigue probably every time you're on, just like everything, just, to remind people that, things like this do exist, and there are outlets to go to if that's something that maybe you're struggling with. But let's change up a little bit. I know you wanted to talk about 988 and what's available there as a resource.
So I'm not yet an expert in 988, but what had happened, not just during the pandemic, but in the months and years that follow, we recognize that we went through a lot as a human race. We went through a lot all over the globe, and so children were impacted, first responders and caring professions, business owners, everybody was impacted in different levels. So suicide rates and overdose rates skyrocketed during and now after the pandemic. So we can call 911 for any kind of medical emergency, and people may call 911 for a mental health emergency, but maybe aren't inclined to. So they created 988 as like the 911 for mental health. So it's a suicide prevention and mental health crisis national helpline. So if somebody were struggling and really just thought, I just can't even do another day, I can't get out of bed, I don't know why I'm living this life, or I'm stuck in this depression, or I'm hearing voices, or I have anxiety, or all the different things that you may not even know that have a name, but life isn't supposed to feel this bad, that you can pick up the phone and dial 988 and get connected to help in your area.
Do you get any information? I know you just wanted to kind of mention that, but do you get reports that show how many people in this area maybe dial 988?
I don't, and I just recently heard some data about the number of calls that came in, and I can't speak to that number. So I don't personally, in my sphere of work, get those numbers. I could even find them for next time, and we can talk a little more about it. But there's definitely like millions of people calling this line nationally to get help. So we know that people learned about it. We need to spread the word. I mean, remember when I don't know that I remember exactly when 911 came out, but when it did, it was like when you dialed 0 and then it became 911, and you could dial 911 anywhere in the nation and get connected to help. And that's the idea here, is that as we talk about this more and more, it's only been since July of 22, as we talk about it more and more, people will start to become so familiar with 988 that when someone's struggling, you can call yourself or on someone else's behalf.
Oh, wow. Okay. You have an event coming up at the end of the month. It's a health and wellness fair. You want to talk a little bit about that?
Yes, thank you. So part of our grant area, and I didn't say a lot about that. I think we've talked so many times now that I forget to mention that I work on federal grant projects through Hammett Health Foundation, and they received federal funding to address substance use in our rural areas. And part of that grant area is Corey, Pennsylvania, and surrounding rural area, as well as Crawford and Venango counties. So we are trying to promote health and wellness, physical health and wellness, mental, behavioral health and wellness. One of those ways that we're aiming to do that is to decrease some of the health inequities that happen in our small communities. Like, people just aren't health literate or don't know where to get the help. They're having symptoms of some kind, but they don't know what it is and maybe don't have medical care. So we really try to promote access to reduce some health disparities. So those disparities are especially rampant in rural areas. So we're hosting a Corey Health and Wellness Fair on Monday, January 30th at the Corey Community Center. It's from 10 a.m. to 2 p.m. And I think right now we have about 20 vendors signed up to attend. It started with 2, like a couple of us, Department of Health and Adagio and myself on the Recovery as NWPA grant projects, said, let's do COVID vaccines, let's give out naloxone or Narcan nasal spray kits and drug disposal kits, and let's do like STD testing for people who don't have access to it. And then somebody else heard and liked the idea, and then we mentioned it to someone else in a meeting, and it has just blossomed into all of these medical and behavioral health professionals saying, I would like to be part of that. Can I bring something? Can I, bring some giveaways or some materials? Or could I do like HIV education and screening? Or could we bring some materials on hepatitis C and the signs? Can we bring diabetes education? And so I think we're maybe going to have we're trying to get somebody to do like a healthy cooking demo. It's going to be pretty great, I think. So anybody who wants to come out and benefit from a health and wellness fair in Corey on Monday the 30th from 10 to 2, join us at the community center.
Free health screenings and referral services. What else will be offered? I see.
So free health screenings, and that could be like COVID tests or COVID vaccines. I don't know we're doing testing. I don't think we're doing COVID testing, but the Erie County Department of Health will be there providing COVID vaccines and other materials and education. Adagio Health will be doing like STI, sexually transmitted infection screening, and get connected to treatment if somebody were to screen positive. There will be HIV education, hepatitis C education, diabetes education. We'll have some giveaways, and some things are like harm reduction kind of giveaways, like condoms and prescription drug disposal and free Narcan nasal spray. They're the little kits that everybody can have at home. It's like knowing CPR. Any bus driver, church, business, anybody can have it, and we're giving it out for free. So we have lots of great giveaways that day.
Well, even the free medication disposal pouches. I mean, that's if you're trying to figure that whole situation out. And again, people lose loved ones, and they're cleaning out their medicine cabinets and trying to figure out what to do with this stuff. You can.
Exactly. So that's one of the things we do with the grant projects is trying to promote awareness of the importance of proper drug disposal, medication disposal. So maybe somebody in the house, an adult or child, was prescribed a stimulant drug for ADHD or ADD, attention deficit disorder. Maybe they were prescribed a stimulant and it had side effects they couldn't tolerate. Now you've got a bottle of these left. And these are the kind of things that can get into the wrong hands or be misused.
Yeah. Well, and times people think it's safe just to flush it down the toilet, but what happens is it gets into our water systems and.
From an environmental perspective, that's atrocious. People throw it outside or bury it or burn it or flush it, which in rural areas is not uncommon. Like when I say that, people nod like, oh yeah, that's what I always thought. But then when the Attorney General said we need to do proper disposal, let's do more of this, let's get some boxes where people can drop their meds off. Most state police barracks, city police, pharmacies, a lot of pharmacies will take leftover medications.
Oh, wow. Okay.
And like I said, police, there's drop-off. But we give these disposal pouches that deactivate them. So they render them... they're inert so that they're not going to hurt the environment. They're biodegradable, but they also then cannot be misused. If somebody was really craving and they knew there were drugs and tried to use it, nothing would happen because it's no longer active.
Angela, another quick segment. If folks have any questions, want more information, how do they get it?
Well, you can call the national helpline at 1-800-662-HELP. You could go to our project website at www.recoveryisnwpa.org, or anybody who needs help can call their local county substance use program and ask to talk to somebody about substance use or mental health services.
Great to see you.
Great to see you too, Luke. Thank you.
See you next month.